Hi, welcome to the session. We will talk about ordering medications in this session. And so one usually opens the chart, it comes to results review, you left click on orders, before ordering medications one should look at the current medications by clicking on IV fluids and medications themselves so that you have an idea of what's been ordered already so that you can avoid duplicate alerts. And so in this patient you can see there's a bunch of medications ordered. However, they're all pretty much all canceled here. So in this test patient, the only thing that's active here that you see is the IV fluid here at 75 mils an hour. And I know that because there's a checkbox here that says it's ordered and the status is ordered. It doesn't say canceled, deleted, or discontinued. So we're going to start by clicking the add button and searching for medications by typing a few letters of their of the name of the medicine, and one can also find medications in these favorite folders like antibiotics, constipation, nausea type meds, and so there's a few system favorite folders, and so we're going to order vancomycin. And so I'm going to type in VANC, and you see that a bunch of orders come up. These orders with the green pill, those are medications, and none of these other things are medications. All meds pretty much have a green colored pill. And so I'm going to order this vancomycin here. And what happens when I order this med is that I see an order sentence window come up, and the key mantra behind ordering any medications and IV fluids is that you select an order sentence and then modify the order sentence. Please never select this none option. I also want you to be aware that there's this pharmacy to dose option, and that's the one to use if you want to start someone on medications such as vancomycin and antibiotics that you want pharmacy to dose based off of creatinine clearance. And so that's the order sentence to use. In this situation, also you see that there's pediatric order sentences, and so we're going to do a pediatric medication after we do the adult one. So let's just pick the typical 1 gram IV Q 24 hours for 7 days. That's your order sentence. And so order sentences are our friends, and we should be always using them. And so here, this alert comes up saying vancomycin peak and trough have not been ordered. And that's okay because all vancomycin orders should have at least a trough level, and that's what the evidence points these days towards. So we're going to get a trough level. We're going to order the trough from within this alert. One can order it outside the alert as well. So you click OK, and a little bit of information says please get the trough half hour before the appropriate dose. You just click OK. It's an FYI screen. Click Done to close your search box, and you'll see that 2 orders got placed into the system. They haven't been signed yet, but 2 orders are put into the chart right now, and that's the vancomycin trough order for the laboratory and then the actual medication order. You can see the details behind the orders here. And so what we're going to do is click on the vancomycin order, and I'm going to drag this detail window up. Typically the window opens and closes with this black toggle triangle. And here every medication pretty much that you order will have a dose, which is in bold, a route, which is in bold, and frequency, which is in bold, and a start date time. It is ultra critical for us to be very cognizant of these bolded fields, especially the start date time, because we don't want to double dose or dose too frequently too soon these dangerous medications. So this is defaulting to today at 11 a.m. However, we should be aware of the previous dose that was given and appropriately start the order off. Let's say, for instance, in the ED they got a shot of vancomycin at 10 a.m. and we want to give them Q12 hours. We should change the date to today, which is today, and then change the time to 10 p.m., which would be 2200 in military time here. And so that's how you would say, I would like to start, the ED gave a one-time dose, but I'm going to start the Q12 hours tonight at 10 p.m. because I know the ED gave the medication at 10, and You would be able to tell that in the medication section. Here you would see vancomycin, a one-time dose given at that specific date and time. You would say it here. This is a pretend patient. It doesn't actually have it here. But in a real patient that had that medicine been given, you would have seen the medicine here. And it would have probably said completed because a nurse would have documented that he or she gave the vancomycin. So let's get back to our order, vancomycin. And so we're satisfying and ensuring that the patient gets the start date time correctly. And then the next order, if I click orders for signature again, basically it brings me to the two orders that I'm about to sign, is the lab order. And now here, if I click on that lab order, it opens a details screen and it asks me for a collection date time of the trough. And so maybe I want the third dose trough. And so the first dose was given in the ED. The second dose will be given tonight. The third dose will be tomorrow morning. However, and so we need to just put in a tomorrow morning date and time. So how would you do that? You just simply clicked on this large arrow, select 29, or you could have gone up or down from the small arrows, and then you would type in, since likely 9 in the morning is when we should notify, because 10 a.m. is the third dose. And even if the doses are off by a little bit, and the nurses will coordinate with the lab to appropriately draw the trough, this is a best guesstimate of around the time where the trough needs to be drawn. And so this is the third dose trough because we've mentally calculated that. And so once the date and time have been defined, pretty much the order is set to go, and you just click sign. And that's how we place medication orders. We want to be careful on the start date time. Next we will talk about how to do weight-based ordering. So if you click add, and let us go and order an antibiotic, and let us do weight-based in this situation. So I'm going to order ampicillin, and I'm going to select a pediatric dose. Let's say we want to give 50 mg per kilogram IV. And all pediatric medications are weight-based, so if you click OK, a weight-based dosage calculator window comes up, and usually the nurse would have put in a weight here. So I'm going to pretend that this child is maybe 12 kilograms. And notice as soon as the weight has been typed in here, it calculates a final dose of 600. You're absolutely free to change it to maybe 650. So you determine the final dose. It just gives you guidelines. It's just a calculator based off of the weight. Normally the nurses will put this in. However, if you knew it, you could always change it. You can change the weight as well as the final dose. So I'm going to put 650 just to play around with it. Click apply dose, and what happens is I click done to close my search box, and notice that the dose of 650 milligrams is automatically put into the dose field. And then once again, to be not harp on it, I want us to be very clear on the next dose, especially with kids. Maybe they got their first dose of ampicillin in the ED at 10 a.m. and so since I want it Q6 hours, I will add it for 4 p.m., which is 1600. So 10 plus 6. So I just basically correctly put in the start date and time to start the ampicillin, and I click minimize and click sign, and I put in the ampicillin order. So that's how you would order pediatric medications, which are always weight-based. A last one that we will use is to demonstrate IV fluids. If I click on IV fluids, I can pick any of these IV fluids. We can do a normal saline, for instance, and let's say I want 100 mils an hour, but let's say I want 130 mils an hour. How would I set that? I would always select a rate, click OK, click Done. And then right here where it says 100, I would simply type in 130. And I would leave these units here. I would not touch them. And simply click away or push the tab button, and it will accept the new rate. And that's how one puts in new rates and orders IV fluids. And here it's going to give me a duplicate, I believe, because, oh, actually it's not, because they're different fluids. So here it allowed me to put in a second IV fluid. And So once we see that ampicillin, vancomycin, dextrose, which was done already, and the normal saline are all ordered. Thank you.